Neutral position theory states the arch is fallen. The answer? Tilt the ground 4 degrees. What happens then? You're walking on the peak of a 4-degree roof with a flat foot. And I showed you that doesn't work for geometric reasons, for anatomic reasons, for physics reasons. Mass position theory states the arch has fallen. Raise it back up. So you can take the entirety of my course, everything I've worked on for the last 13 years, and reduce it to one sentence. I'm the guy who turned arch supports into arch supports. This is the neutral position orthosis, and on the same person, the mass position orthosis. The trouble is that when you treat somebody in the pathologic zone, all you're doing is masking symptoms. Masking symptoms. Getting people from just above the threshold to just below it. And studies are now showing that most custom orthotics are equal to prefabs in their ability to mask symptoms. In other words, standard neutral position custom orthoses are exactly as good as prefabs in masking symptoms. What do I mean? Pfeffer Study, Journal of Foot and Ankle, April of '99. 238 patients in 15 centers across the United States for the initial treatment of plantar fasciitis. 5 modalities compared. Prefabs beat customs. Customs made by the chief of biomechanics at the California College of Podiatric Medicine. February 2001, mechanical treatment of plantar fasciitis. Again comparing customs and prefabs. What did they find? No statistically significant difference between the treatment groups. Here's the customs, here's the prefabs. Imagine yourself an insurance company. Do you see $500 worth of difference right there? Neither do they. They did prove quite conclusively, however, that flat hard orthotics are indeed flat hard orthotics. Landorf study, JAP 2004. At this time, however, it is not possible to recommend either prefabricated or customized orthoses as being better. Archives of Internal Medicine, 2006. Again, Karl Landorf's group. Foot orthoses produce small short-term benefits in function. May also produce small reductions in pain for people with plantar fasciitis. But they do not have long-term beneficial effects as compared with a sham device. Done at La Trobe University of Podiatry in Australia. Biomechanics, October of 2000, Laurie Tiss and Beth Higby. Orthoses reduce pressure but fall short of biomechanical correction. In the article, they say, according to Root, during the push-off phase of gait, plantar pressure should be highest under the medial forefoot and hallux. In contrast, the standard neutral posted orthoses in the study seem to reduce plantar pressure in these regions. You know what, first day in podiatry school, somebody wrote on the board, Primum non nocere. You know what that means? Doctor, first, do no harm. We were making the gait cycle worse. But the jury is in. The verdict has been rendered. There have been 2 meta-analyses. The highest level of evidence-based medicine is the meta-analysis. A meta-analysis takes all of the studies in a particular area, puts them into a huge N study, and then imposes rigorous statistical analysis. There have been 2 meta-analyses now comparing customs and prefabs. What have they found? They are identical in their ability to mask symptoms. What I'm telling you is, when you treat the symptom and you leave the disease, you have recurrence. Masking symptoms is just unacceptable. You wouldn't take it from your heart surgeon. You go in and say, Doc, I'm having chest pains. I want you to go in and take just enough plaque out of my arteries so my chest pains go away. No, I want you to go in there and return me a functional blood vessel to feed the heart muscle. That's what it's about. You don't want to mask symptoms. What mass intervention focuses on instead is changing posture and function. You're entering an interesting era in foot biomechanics, where your competition is not the podiatrist across the street. Go and take a field trip to Walmart. Go to the pharmacy. They've got a pressure plate. Go to footmapping.com. You stand on the pressure plate, lift your right foot, lift your left foot, and they tell you which customized orthotic you should get out of the kiosk. How can you fight that? By raising the bar. We must differentiate ourselves from Walmart and Costco. If we set the bar at masking symptoms, Dr. Scholes can jump over that. If we set the bar at changing function, only we can jump over it. The future is to differentiate yourself. So what we can now say is, masking symptoms? Go to Walmart. Let's set the bar up here at changing function. That's why you came to a doctor. And for athletes, that's so important because they push themselves to their anatomical limit and overuse surgery. What if we could push that limit further? Will they still get an overuse surgery? Probably. They'll push themselves to the new limit. But they'll achieve more. Like we've been supplying the Denver Broncos now for 9 years. Does that mean they won the Super Bowl? No. That's not. If they win the Super Bowl, it's because of their talent, not because of their orthotics. But it does mean they've had the lowest incidence of lower extremity injuries in the entire NFL for 9 years. And that's why now the Lions and the Bears and the Seahawks, UT, Alabama, Auburn, and next month the Gators are coming on. Kind of exciting. So I want to thank you for having me. And the rest of the time, I'm going to teach you the actual technology of casting using mass theory technology. Thank you very much.